of them.
Hello and welcome to the special edition COVID-19 Rogers television program. My name is Carol Merton, and today I'm delighted to welcome as a guest Colleen Trask Seaman. Colleen is the Executive Director of OSHaRE, and she's here to provide us with an update on things that have been happening through COVID and especially now with OSHaRE. Colleen, do I have your title correct? Everyone's been changing titles through COVID. Is there anything else I should add to that title?
No, I am the Executive Director of OSHaRE, and no title changes.
Thank you for being on the program. And you know, who'd think that at this point in time, after all this time, we'd be still talking about COVID, but OSHaRE has been such a critical component of our community caring for each other through the pandemic. And I'm wondering if you give us a little bit of an idea on what's been happening. I know you've been putting through a lot of meals, and how you and everyone else is doing, coping with all of this.
Yes, well, it definitely has been a challenge. Thank you so much for having me on today to share with the community. OSHaRE really is all about community. It was started by the community, it is run by the community, and it is obviously very well supported by our community, and we couldn't do what we do without it. So thank you for allowing us the opportunity to share. OSHaRE, yes, I remember when we got that first call that things were going to be shut down in March of 2020, and we all thought, okay, well, we can do this for a month. And who would have thought that we would be here 2 years later and still trying to navigate at times what we're doing. But yes, so OSHaRE has definitely seen an increase over those 2 years for example, in 2019, we served 22,000 meals.
Okay.
And in 2021, we served 108,628 meals.
Oh, that gives me goosebumps. What an increase.
Yes. And so we serve meals twice a day. We serve a hot lunch for the winter months from 12 till 1:30. And we also serve a supper meal. And during the winter, we allow our guests the opportunity to take their supper at lunchtime, because we all realize that coming out in the snow and in the dark, and especially right now with the ice that we have, it can be really challenging. And so guests can pick up a cold supper at the same time as they're here for lunch, so that they only need to come out in those elements once a day, which is a bit nicer for some of our guests who it's a challenge to get here.
Yes.
But we are open for supper from 4:30 to 5:30 for those people who choose to come out twice or only attend for supper time. So, but yeah, the increase has been incredible. But our community has stepped up all the way along, helping us to make sure, both with volunteering and with donations, to make sure that we've been able to meet that need. So
certainly, I'm going to put a plug in to say, for people who wish to continue to donate or to consider donating, the need is there. It's obviously grown. How can people donate, Colleen?
Yeah, so we have a few ways. So we do have a mailbox right at OSHaRE. That's outside the building. It's a secure mailbox, so people are welcome to drop off donations anytime. We are a registered charity, so you will receive a tax donation for any money that you give. We also welcome people into the office if they want to come in to make a donation. You can also give online at info@oshare.ca is our email address, and then you can just give right online at oshare.ca.
Yeah.
And then the other way people can give is with non-perishable foods. Sometimes we're coming back up to spring, yay, and gardening season, and we welcome donations from our community of extra vegetables from their gardens. We can accept all of those. The main things that we can't accept are meats, dairy, eggs. Those are things that we have to get from a supplier or have a chain custody of food type thing that we can document where food has come from. So that's a bit trickier. So, but we do encourage, if people want to give food that non-perishable canned goods or fresh fruits and vegetables are always wonderful and great for us to be able to share with our guests.
Excellent. So a variety of ways that people can donate. And now, I mean, you've been doing this right from the very, very beginning, correct?
Yes, we didn't close for one single day.
Are you surprised by the numbers?
Definitely, yes, and surprised by the continued need. We are still seeing a large increase in January and February of this year, and we kind of, you're always wondering when we might see that decrease happen, but at this point that hasn't happened for us. And so the numbers are still coming in really high. I think that there's just a lot of people who are struggling, and the reality is costs continue to go up for food and rent, all of those things. And so that's definitely putting more strain on many of our guests.
Yes.
And so to be able to get a meal at OSHaRE helps to make the money that they do have go further.
Yes. The guests that do come, and I really like the word guest because it just has a great connotation about being welcome to come and get food. And so are you seeing new people come that you hadn't seen before, or age groups that you really were surprised to see that you hadn't expected to see?
We're definitely seeing new people every day. We also are seeing a lot of families who have never had to access services before who are needing some extra help. We've started a school lunch program where we will give you a bagged lunch that's appropriate for your child to take to school.
Wow.
And so we are seeing those increases, but generally it's right across the board. We have guests of all ages who come to OSHaRE, and basically our philosophy is if you need a meal, you just come to the door and we'll give it to you. We don't ask any questions. We're just here to share what we have with our community.
Because that is your motto, right?
Yes, what we have, we will share.
Yes. So I know you and I've chatted before, and I've had the pleasure of coming and seeing the facility. And it used to be that people would be able to come and actually be at the tables and have a meal together. But that's not possible at this point. When do you anticipate, I'm forever hopeful, that may start with the restrictions? Do you have a kind of a rollout plan or idea?
So it's something that we're constantly talking about. Our guests definitely miss that opportunity to come in and sit down and share with each other, share with our volunteers, have those interactions. And so it's definitely something that we want to see happen. There's a lot that plays into trying to make that happen, again, though safely for our guests and volunteers, as well as trying to meet this huge increased need.
Yes. So consciously, you'll gradually consider how you'll move forward.
Yes, very much so.
So even if the province lifts the restrictions, you have specific requirements that you have to put into place. So you're you have to work that through.
Exactly. Yeah. It's going to be a process. And we've been learning things as we've gone along through COVID too, that, things will look different probably coming out of COVID than they looked going into COVID. But the reality is that we realize that, we want to provide that opportunity for people to come together to share a meal, because that is very important. And I mean, before COVID, we celebrated birthdays. We celebrated the tooth fairy visiting for the first time. Like, all of those things were things that we celebrated as a community family here at OSHaRE. And those things are important for our guests. And we've tried over COVID to offer as much positivity and checking in with our guests to make sure that they're doing okay, from behind our masks, which makes it tricky. Yes, but we realize that this community needs a place to gather and to share together, and so we do really want to do that. It is just going to be a longer process than just simply all of a sudden being open again.
Yeah, and I think that's an important point. People are sort of going by the dates, when the government restrictions, but we can't go by that necessarily. We have to look at all of the factors. So a couple of questions about moving forward. And first of all, with the increase in demand, are you going to need to increase your space? Don't answer that if it makes you uncomfortable, but I'm thinking, if you've gone from those numbers, is there enough room if people want to come and join, or will you have staggered lunches? And
these are all things we're exploring. Everything.
Okay.
Yes, it's, we love our space, and it's suited perfectly to us. We've definitely been looking at different meal times to try and accommodate more people. We've looked at offering a few different models in order to be able to accommodate the increased need. We're just still kind of waiting to see where everything goes in the next couple months to know best how we can serve and keep everyone safe.
Yes, and the numbers, like, figuring out once the dust settles what your baseline would be, because if the need has changed, will you be going back to that 22,000, or will your numbers certainly be higher? Do you anticipate that you might consider a mixed model where people can come and eat and take away? So there's options. I'm hearing from a lot of organizations that they call it hybrid, where, I don't know if that's the right term, but
that's what I call it too. So, and that's definitely one of the things we've been looking at, because we have learned some things through COVID, including that for some of our guests with smaller children, it's easier if they're able to take a meal and go home and sit around their dining room table than to bring their whole family to OSHaRE on a snowy, cold night. Yep. And so, they've really appreciated the fact that we've had the takeout. And so that's definitely, we're trying to learn through all of this too, how best to serve, because that's the reality for OSHaRE. We're here to serve our community, and whatever we can do to make that the best for as many as we can, that's what we want to do.
One of the things as a community, we've learned is the importance of partnerships. And I know OSHaRE partners with a variety of organizations. Maybe you can chat about how those linkages help the community. Yep. And also wondering if you could talk a little bit about the food rescue program.
Yes. So I'll talk about food rescue first. We love food rescue. We are so thankful for food rescue through the pandemic. And even before that, food rescue has allowed us the opportunity to give our guests such healthy, nutritious meals while rescuing food that would otherwise have gone to a landfill site. So food rescue is a program where we work with local businesses, restaurants, grocery stores. Shoppers Drug Mart is involved with us, which is great. Starbucks, lots of different businesses, and basically food that has either is coming to its best before date,
Yes.
but still safe to consume, and or produce like a bag of apples that has one bad apple in it. Obviously, in the grocery store, people aren't going to buy that because they want the bag that has all the perfect apples in it. So that food comes down to OSHaRE in a partnership with the United Way. They pick it up and they bring it down to OSHaRE. We then go through it. We take that one yucky apple out. We compost it with a local farmer who we have an arrangement with. And then the 7 other apples out of that bag get washed. If they're good for handing out to eat, then that's what happens. If they need to be made into applesauce, we make applesauce every single week at OSHaRE. And the apples that are good and ready to be able to just be handed out to eat, either we use those or we now work with a lot of other agencies across Grey and Bruce and provide fresh fruits and vegetables or anything excess that we get through donations to them. So we work with Southeast Grey and their Yum program every week. Baskets of fresh produce go down for them to be able to use, and all of that produce is coming from that food rescue. Wow. So we have a whole group of dedicated volunteers who come in and go through boxes of produce, picking out the yucky stuff and composting it and saving what we can. And it's been amazing. Last year, we rescued 199,000 pounds of food.
Wow.
Yeah.
That would have gone into landfills. So that in itself is an environmental plus.
Yes.
And it feeds people, which is another environmental plus.
Exactly. And we're able to share that with our guests, but also with other organizations, the REACH program, the Yum program, CMHA, all of those programs. We're able to put out a thing saying, hey, we have a whole bunch of apples. Perfect. If you need them, let us know. So it's been really amazing, the food rescue program. And it started in Toronto. That's where it's through. It's through Second Harvest. And any business can go online and they just list what they have. And then we can subscribe to say, we'll pick it up, and we bring it and go through it. So it has been an incredible program, and we're so thankful for it. It has made a huge difference. Pretty much every day during the pandemic that we have been serving, we have had fresh fruits and vegetables to give our guests.
That's amazing. And certainly so helpful for, as you mentioned, families or individuals who are finding it really, really hard with changing costs and pricing of food as well, which we've seen. What you're really describing on a previous program, there was some discussion, it wasn't in social services and the service sector, but healthcare, about silos. But what you're really describing is an actual system where there are no silos, that people share what they have and you send the messaging out. And that is an amazing example of connecting and networking and partnership. Because rigid borders and boundaries aren't feeding people.
No. And we, like this past year, we were able to share 30,000 pounds of food with other organizations. That's a lot of food.
Yes.
and food that they needed and that they can use to help their clients. And so yes. I love that is something that I've seen really strongly come out during the pandemic, is this us all working together. We're all yes. working together to make sure that we're doing the best for our community and that we're using our resources the best that we can. And I think that it's a great motto. What we have, we'll share. And,
yeah.
and so we're able to.
Sorry, Colleen, I interrupted you, but
No.
your motive, what I also think is it must benefit the businesses because they don't have to pay for tipping fees or so it's a win-win because they actually can benefit by having the food go somewhere else. Am I right in saying that?
Very much so. And all of the ones that we talk to regularly, they're just so thankful that they're able to take what they aren't able to use and share it with their community in a positive way. And Zares has been a huge donator for us of food rescue. We pick up there every single day, and
Wow.
and they're just so happy to know that the food is going to help their community.
Excellent, excellent. So how are you and your volunteers doing? I mean, you must have had a challenge with volunteers and coping. So how is that working now? And how are you doing, Colleen? Oh my goodness. What you're describing is like phenomenal. How are you doing?
We're doing well. We're doing well. Honestly, the community has been so great. We've had a dedicated group of volunteers who have stepped up the first day of the pandemic, and we're like, okay, what can we do? And when we had to decrease our number of volunteers due to trying to keep the environment as safe as possible, some of my volunteers stepped up and said, you know what, I'll volunteer 5 days a week. I was like, okay. And so,
Wow.
yeah, they have been incredible. And so and then we've had moments where we were like, okay, we can open back up for more volunteers. And then times where we've had to say, okay, no, we have to tighten back up. I mean, the reality is a lot of my volunteers are in the high risk category for COVID, as well as our guests are high risk. And so we have been really cautious all the way along to try and keep everyone safe. And so my volunteers have been incredible to just say, you know what, we've got the time, let's do this. So that's been incredible. We're all doing good. It's a challenge, but the reality is that the community has been so supportive that in moments, I can honestly say, in moments where we've been like, oh, okay, like this is a lot, there's like a little card in the mailbox, or
Okay.
someone sends me an email that just says, hey, thanks for doing what you're doing, we can't be there to help, but we just want to encourage you, or those types of things, which has made a huge difference. We have a whole board in OSHaRE where I post all of those cards, so that when volunteers are in, they get to see those and see how much what they're doing means to our community. And our guests, I mean, every day they say thank you and sometimes they give us little cards and stuff, and we post those on our board. And so that really is what keeps you going, and knowing that what you're doing is making a difference.
It's making a difference every day in the life of these individuals who are highest risk in many ways. If you don't get your nutrition, it puts you at risk for other challenges for sure. I mean, you're dealing with feeding hungry people who need to be fed.
Yeah.
And that's remarkable. Now, I understand, I mean, you receive food and you distribute and you prepare food. But there might be individuals with special needs. How do you address that? I know you're not a restaurant. I get that.
Yes.
But all people are different, and some people have special needs. Are you able to accommodate special needs?
So we try our best to serve all of our guests. The reality is, exactly like you said, we're not a restaurant, but we have enough of a variety of food on hand that we are able to cater to special diets. We have some guests who need diabetic diets. We have some gluten-free guests. We take what we have and we share it. That doesn't always mean that they're going to get the same as everyone else. It might have to be a little bit different based on what we're serving. It doesn't always mean that they may, depending on what their dietary needs are, it might be very similar day after day because we have to use what we have on hand or that we can purchase a little bit of. But we meet those special diets the best that we can. We work with the health unit and are able to have some dietitian help when we need it, which is great.
Okay.
Yeah.
That's extremely important to be able to have those resources available as well to you. So we know that unfortunately some businesses have closed, which means that there may not be jobs.
Sorry.
Yeah, I see your point. That's okay. It's all right. We'll just keep on rolling. You can direct traffic. So, people may not be able to get back to jobs if they had worked in businesses or restaurants or whatever. And also the cost of food has gone up, the cost of living. Moving forward, you may expect to continue to see people requiring needs and food. One of the things that certainly struck me, obviously the families, but seniors have been needing food as well. And we've just got a couple of minutes left in the program. I wonder if you can speak a little bit about the fact that, we have hungry older people as well out in our community.
We do. And we definitely have seen an increase in the seniors who are needing assistance. But what we've also seen is that there's neighbors who want to help those seniors in their communities. And so we, as I said, we don't have a when you come, you just tell us what you need, how many meals. And so we've had an increase in neighbors who show up and say, I'm picking up for this elderly neighbor that I have. It's hard for them to get out. Can I get a meal for them? And we are always like, yes, please. Like, that is great. OSHaRE doesn't have we don't have the manpower to be able to deliver all over the city. We really rely on people coming to OSHaRE. But the reality is that if you can't get here, you can send a neighbor, you can send a friend to pick up that meal and take it to you. And we've had people who have told us that their doctors have told them, if you're having a hard time cooking for one and getting kind of that balanced meal, go to OSHaRE, they'll help you. And so we've had people who have come and said, my doctor told me to come.
Wow.
And we're very happy to help. And sometimes they're able to help by donating as well, which is great if they are able to, but that's not what this is about. This is about the community being able to help each other and to serve each other. And
that summarizes exactly what you do, Colleen. I want to thank you so much for being on the program. It's delightful to speak with you. And I'll look forward to having you back when we're not talking about COVID.
Yes. Me too.
Yeah. Take care, and thank you to you and all the volunteers who are making our communities healthier and fed. Thank you to our viewing audience as well for joining us today. Please join us again to learn more about programs, services, and resources available to you and to your families. Take care and stay safe. Thank you.
This program is brought to you by NBA League Pass. More dunks, more slams, more to love, live in HD. NBA League Pass, part of the Rogers Super Sports Pack.
Call the Rogers TV viewer response line, email us, or connect with us on social media.